This skill is administering an NG tube feeding. This can be found on page 500 to 502 in your Fundamentals Handbook. Again, this is just a basic run-through. It does not give all the rationale. It's just to give you an overview and an idea of how things work. Make sure that you refer to your book and the skill. First thing you're going to want to do is check your doctor's orders. You're checking to make sure that you find out the type of feeding, the amount, and the strength of the solution. You're going to assess the abdomen for any distension or tenderness. And then you will elevate the head of the bed 30 degrees. You want to perform hand hygiene and put on gloves. For this demonstration, we're using the NG tube, so you're going to want to check placement. The first thing you will do is, again, check placement by listening.
Measure residual. Got bubbles.
And you also check for residual. And you also replace any residual. Once you've verified placement, you're going to have the correct fluids, and you're going to place it into a container that has measuring so that you make sure you give them the right amount. You're going to take the back off of the syringe and place it into the NG tube. And then you're going to slowly pour and let gravity draw in that fluid. After the feeding is done, you want to make sure that you flush with water. Once that tube is clean and flush, you want to reclamp it. And monitor your patient.